Coverage on the opioid crisis and what's being done to try and get these overprescribed medications off our streets.
Beginning with Action News reporter Sally Kidd, who explains what today's announcement means in the fight against the epidemic.
Dan and Aaron, the president is calling this crisis a national shame and human tragedy, says this is a critical step in confronting the challenge.
Effective today, my administration is officially declaring the opioid crisis a national public health emergency.
President Trump putting the weight of his office behind the nation's opioid epidemic, ordering federal agencies to use emergency authorities to combat the crisis.
I want the American people to know the federal government is aggressively fighting the opioid epidemic on all fronts.
The White House says the order expands access to medical services in rural areas. It provides grants to states for worker displacement programs and gives them more flexibility to shift federal dollars to address opioid treatment and addiction.
Confront it head on, straight on, strong. We're going to do it.
But the declaration doesn't add any new money to the fight.
With no new federal dollars, they're going to be taxed even more.
Some healthcare advocates say without that extra funding, the hardest hit states will still be in a pinch.
With no extra money, it's going to be hard for them to make the choices they'll have to make between things like HIV prevention and now opioid prevention.
The White House says it will ask Congress to dedicate additional funding to back the effort. The administration hoping to get a handle on what the president calls the worst drug crisis in U.S. history. And we're hearing reaction from Democrats in Congress who are saying without those additional resources for people on the front lines of this crisis, the president's declaration is only words. At the White House, Sally Kidd, KSVW, Action News 8.
Sally, thank you. This Saturday is National Drug Take-Back Day. Anyone can anonymously and at no cost turn in unused or expired drugs for proper disposal. Events happen all over the Central Coast and all across the country, but not in Santa Cruz. Our State of Addiction team coverage continues now with Action News reporter Phil Gomez. Joins us live from Santa Cruz to tell us why that is. Phil?
Santa Cruz County saw a need for safe disposal of unwanted meds and used sharps and implemented such a program in 2015. So, in a way, every day is Drug Take-Back Day in the county.
A lot easier here. We've been doing it for a long time, and it's a program the rest of the country wishes they had.
Santa Cruz County created the Extended Producer's Responsibility Ordinance, where unwanted medications and used needles can be dropped off at pharmacies.
Every pharmacy is participating. There are also bins at many medical clinics, at county health centers. The local cities are all in various stages of implementing this.
Last year, more than 17,000 pounds of leftover medicine and more than 10,000 pounds of sharps were collected.
The other thing that we're doing is we're expanding access to drug Medi-Cal through a coordinated effort with the state. We're opting in concert with about 40 counties to expand the services that we provide, which ranges from early intervention all the way through treatment, residential and outpatient capacities.
Drop-off sites for unwanted medications are also available at sheriff's substations and police headquarters, along with the 3 used needle kiosks established in the county. Other locations are already in the works.
The container gets snapped closed and is contained.
Mark Wilson of Horst Snyder Pharmacy and Medical Supply is developing the first of its kind, a single sharp container.
You have to come up with a concept where it's leak-proof and also puncture resistant. It would be something that would be really, really worthwhile in developing.
The Wilson project remains a work in progress. It must receive FDA approval in order to get on the market. Aaron?
All right, Phil, thank you.